Hi, my name's Isaiah Young and welcome back to Bison Osteo. In a lot of my sessions, clients bring in old scans that they used to get, x-rays, CT scans, ultrasounds, MRIs, anything that can possibly help them demonstrate and give me further understanding as to what they're dealing with. But what if I told you that just because a scan shows something, it doesn't necessarily mean it's the cause of any of your pain? I love Pushy the cat. My girlfriend will agree. First, we have to come to an understanding. Just because something is found on a radiological film, it doesn't mean that it is pain producing. Pain is an intricately complex mechanism full of external and internal factors controlling the intensity and duration of pain. Environment is a good example of potential external factors. This might include a poor sleep environment, such as poor sleep quality and/or interrupted sleep. This can increase the pain that you feel. Work-related factors may increase your pain as well too, such as a decrease in positional variance, i.e. a desk worker who doesn't move around much. Even your socioeconomic status may increase your pain, due to a further burden of financial stress and a decreased ability to access facilities or support. Some potential internal factors include a decreased amount of physical activity, which may affect your robustness and leave you more vulnerable to pain-producing symptoms. Even mental health conditions like anxiety and depression can increase the level of pain you experience due to an inability to avoid catastrophizing. So you can see that before we even mention any musculoskeletal or biomechanical components, there's many factors that can contribute and even cause pain. But why are scans sometimes not helpful? Well, sometimes scans actually pick up asymptomatic findings. This creates fear, uncertainty, and doubt, or FUD, in the actual person who got the scans. For example, Brinjikji how do you say that? Brinjikji et al. Did a large systematic review on 33 different scientific articles where they performed scans on individuals who had no symptoms of pain and found that 37% of 20-year-olds, increasing up to 96% of 80-year-olds, had a form of disc degeneration in their scans. They also found that 30% of 20-year-olds had disc bulges, increasing up to 84% of those aged around 80 years old. In another study by Girish? Come on, guys. Easier to pronounce names, please. In another study by Girish et al., 26 individuals aged 40 to 70 with no symptoms had ultrasounds performed on their shoulder and found 96% of them had some form of radiological finding, despite having no symptoms of pain. Subdeltoid bursa thickening in 78%, AC joint osteoarthritis in 65%, supraspinatus tendinosis in 39%, and even partial thickness tears of supraspinatus had no symptoms at all and was still found in 22% of people. What I'm trying to get across is that musculoskeletal scans can actually create fear by picking up radiological findings entirely unrelated to the pain, and this can actually unintentionally lead to pain increasing in duration because of unnecessary interventions. So should you never get a scan? No, not true. Scans are an amazing tool for visualizing the body and give specialists like doctors and surgeons the ability to visualize what's actually going on internally at a stationary biomechanical and physical structural level. They're often very important when going through the legal system like the Department of Veteran Affairs in Australia, work cover, or the NDIS in creating a paper trail for your diagnosis and proof of injury. And they are also extremely vital for visualizing and detecting, sometimes early, serious pathologies like tumours in the bone, such as multiple myeloma, which couldn't necessarily be detected any other way because often they're asymptomatic for a long time while developing. But the regular use of scans doesn't seem to have a potential benefit as to the course, duration, or intensity of someone's pain. Therefore, when possible, we should avoid using scans and not rely on scans as well too for our diagnosis and reasoning as to why the pain actually is occurring in someone. So what should you as a patient actually do? You should see a health practitioner. Find a health professional who relates and empathizes with your situation. They should help you create a plan with achievable steps to help you get back to your goals and desires. This might be through active rehabilitation, manual therapy, or another outlet, but as long as it provides meaning and benefit to you, that's fine. It will help your pain. If you've got any questions about anything I've spoken about today, please let me know in the comments. Please message me. I'm happy to talk about it a little bit. But take action for your health this year. Find a way to increase the level of activity you do in a safe way. And as always, I'm here to help. Cheers. What's that? What did you want to say? Push in? Find a health practitioner near you. Wow, that's insightful. Good cat. Oh, I'm losing my marbles. Should probably go outside.